Welcome to OMEG-Ed. Hi there, let's talk about keratoconus today. But what even is keratoconus? Well, kerato means cornea and conus means cone-like. And while a cornea cone sounds like a really strange snack, it's actually a condition of the cornea that, although progresses and significantly affects vision, can be diagnosed early and treated early. Let's say this is a cornea. Keratoconus occurs when changes within the corneal layers cause too much elasticity and the cornea bows forward. Specifically, the collagen in the corneal stroma is what is weakened and too pliable. Now, remember this term, collagen, because it will come up again later. A couple of factors have been linked to keratoconus: genetic predisposition to allergies or inflammation, UV light exposure, intense eye rubbing, and poorly fitted contact lenses. Keratoconus can show up in childhood or later in life, be mild to severe, and may be found in multiple members of one family. In fact, someone with an immediate family member who has keratoconus is up to 70 times more likely to have it, which is why routine eye examinations are so important. Here are some early warning signs of keratoconus: irregular astigmatism and loss of changes in glasses prescriptions, halos and starbursts around lights, and the vision just overall getting blurrier. Keratoconus can be diagnosed using corneal topography, which looks at the very surface of the cornea and identifies areas of steepening and irregular corneal astigmatism. Corneal tomography is also extremely useful because it compares the front surface of the cornea against the back surface of the cornea, identifying areas of changes at each surface and finds irregular areas of corneal thinning too. It is our belief that early diagnosis and intervention can save a patient from a lifetime of visual disability, and this is possible because we as a scientific community know a lot more about keratoconus now. So let's talk about treatment next. The goal of treatment is to halt progression as quickly as possible, and then improve the corneal surface irregularity for optimized visual function. The old treatment continuum used to be glasses or soft contact lenses, then rigid lenses or specialty contact lenses, then once the keratoconus was advanced enough, then a corneal transplant. Today, not only can we intervene much earlier, but a treatment called Corneal Crosslinking has been shown to be the most effective at disrupting keratoconus progression. The best part of this? It can be used to treat young patients as soon as early keratoconus is diagnosed. Let me tell you a bit about how corneal crosslinking works. Remember how we talked about collagen? Well, in the cornea, collagen fibers are held together with chemical bonds. A healthy cornea maintains its shape because the crosslinks between collagen fibers are strong. But in keratoconus, the collagen fibers need to be strengthened. Corneal crosslinking synthetically increases more bonds between the collagen fibers so that it becomes more rigid or less elastic. Using riboflavin, aka vitamin B12, and a very specific wavelength of UV that does not damage the back of the eye, more bonds or crosslinks are created, kind of like adding more mortar to strengthen a brick wall. At OMEG, the very top surface of the cornea, the epithelium, is removed. Then, riboflavin is dropped onto the cornea to saturate it every 2 minutes for 30 minutes, and a UVA lamp is shone at the cornea for 5 minutes to allow the chemical reaction to take place. The riboflavin helps with UVA absorption and protects the very back layer of the cornea, the endothelium. A bandaged contact lens is placed on the eye, topical medication drops are used, and the healing is monitored for the next few days until the bandaged contact lens comes off. This method is the most effective. This works so good that the rigidity of the cornea is increased by over 300%. In fact, corneal crosslinking is approved by the FDA. After the collagen is strengthened and keratoconus progression is stopped, lots of different options can be done to make the cornea surface more regular so that vision is better. These are all options that can be discussed after the corneas are healed. We are always a resource for any questions and comments you might have. Feel free to email or call us anytime. Our contact information is included in the description section of this video. And that's it. Thanks for watching OMEG-Ed.